So thank you everyone for coming tonight. I know it's always hard to get onto the computer late at night after a long week, but I'm really excited to share about what exactly the pelvic floor is and all about pelvic health and how it's related to digestion. So a little bit about me. So I was born and raised in North Jersey. I went to school at Penn State for my undergraduate degree and received my doctorate in physical therapy at Rutgers University in New Jersey. In 2021, I moved up to Boston and I've been with Wellist ever since. And a fun fact about me is that during PT school, I started my own side business, creating and selling study materials and an Etsy shop that I also share on my Instagram account, PT Study Guide. So you can kind of see my artistic side of things on that account if you're interested. Okay, so this is like one of my number one questions that I always get from my patients. How did you get into this field? Because it's not a very common side of PT. So I was actually introduced to pelvic health while I was still in PT school. I decided to do my capstone project on a women's health topic, which was observing infection rates following C-sections in obese women. So when I was doing all of the research for that project, I realized that there's really not much research out there in regards to women's health, pelvic health, any of it. So it really just got me wanting to do more in the field and learn all about it. So while I was still in school, I actually applied for a scholarship to take my first course in pelvic health, and I won, which was super exciting. And a fun fact about that was that the scholarship was funded by a company called Intimate Rose, and a lot of the pelvic health products that we recommend to our patients are actually created by this company. So all of that kind of got me just way into the pelvic health field before I even graduated school, which is a little bit different than a lot of people's journeys when they're going into this field, because I think that a lot of people find out about pelvic health after going through some of their own pelvic health issues and then getting treatment for it. So I kind of got into it a little bit early, which is great. So before we go any further, we should probably talk about what the pelvic floor is, because it's kind of a vague thing if you don't know what it is. So I have a little picture on the side here of the pelvis. And so you can kind of see from the top view. So if you were looking at a person and you cut them in half, this is what you would see looking down. So if you look at the bottom of the pelvis here, this is where the pubic bone is. And then the back is this bone called the sacrum. And then the sides are kind of like the hip bones. So all of the red you see at the bottom is muscle, tons of muscles in the pelvic floor. So there's 3 layers, and they're there for bowel, bladder, and sexual functioning. So we often don't think about these muscles at all because they're always working in the background. So if there's any dysfunction going on, that's when we're actually noticing these muscles. And just like any other muscle in the body, they can become tight and painful if they're working too hard. And then, so if we look a little bit further at this model, you can kind of see here at the bottom, there's these 3 holes. So at the top, there's the rectum, the middle is the vaginal canal, and the bottom is the urethra. So you can kind of see that there's like this sling of muscle that wraps around all 3 holes. So when someone is doing a Kegel, what's happening is this muscle that's wrapping around here is contracting and shortening and basically closing the holes. And when you relax that group of muscles, it allows the holes to open. So if there's any dysfunction with that group of muscles when they're contracting or relaxing, when they shouldn't be, there's going to be problems with bowel functioning, bladder functioning, and sexual functioning. Okay, so that leads me to what does pelvic floor dysfunction look like? So that could be pain in the hips, the low back, the groin, or the inner thighs. Sometimes it can look like constipation or diarrhea, trouble fully emptying the bladder or bowels, pain with vaginal penetration, which could be pain with inserting a tampon, pain with a pelvic exam, or during intercourse. And it could also be urinary leakage or incontinence. So like I said, bowel, bladder, and sexual functioning. And then, so if we're talking about digestion and how this relates to the pelvic floor, we should probably define what constipation is, because everybody has their own definition in their head. So that could mean having less than 3 bowel movements per week. That could mean your stool looks lumpy or hard or in small little bits. It could mean that you're straining to have a bowel movement, or you could be not fully emptying when you're trying to have a bowel movement. So this is the Bristol stool chart. This is a chart that we often use during our initial evaluation with our patients. So in general, we're just looking to see that you're having more of the type 3, type 4 types of stool commonly. So if your normal is on the either end of the spectrum, so the type 1 or the type 7, we know that there's something going wrong. So we're going to ask some more questions about that. So some common issues that we see with bowel dysfunction are chronic dehydration or toileting habits, which could mean straining, toileting posture, avoiding using the bathroom when you need to, tension in the abdomen, scar tissue restrictions from previous pelvic surgeries or abdominal surgeries. So that could be a hysterectomy, a C-section, any kind of laparoscopic surgery, or even like an appendix removal or gallbladder removal or any of that kind of thing. Chronic stress, and of course, pelvic floor tension. So how can pelvic floor therapy help with constipation? So before we give you a whole treatment program, we're going to have to figure out what's going on and causing this to begin with. So we'll go through your whole medical history with you, and we'll ask you about medical conditions, surgeries, injuries, childbirth history, medications, diet and lifestyle habits, exercise routine. We're going to go through basically everything related to your health with your whole body, because I like to say to my patients all the time, the pelvic floor doesn't just float in space, it's connected to the rest of your body. So we kind of have to go through everything. And a lot of people who treat this area of the body have like a very tunnel vision focus on the pelvic floor itself. But we like to take a step back and look at the whole body, because like I said, everything is related to each other. So we'll take a look at your posture and mobility, make sure that everything is moving correctly. And we can also perform an internal pelvic floor assessment. So that's going to give us information about how, if there's any tightness in your muscles, so the tone, and your ability to actually contract and relax your muscles. So like I mentioned before, when people think about pelvic floor therapy, one of the first things that comes to mind is probably a Kegel and doing Kegels. And that is not always the best thing for your body if you have tension, if you have pelvic floor tension. So in order for someone to say, this is what you should be doing, getting information from a pelvic floor assessment is really the best way to go. And the way that we do that for anything related to the bowels, so we can either do a pelvic floor assessment internally, vaginally, or rectally. And it's totally up to the patient. The only difference is, it's all the same muscles. You can kind of get information about the pelvic floor from either way. But to reach some of the muscles in the back of the pelvic floor, it's just easier to perform a rectal exam. So that's the difference with that. So what do we do during treatment? Treatment sessions commonly involve a combination of manual techniques and establishing a home program. So some of the things that we do during treatment could be myofascial release. A lot of it is diaphragmatic breathing exercises and teaching you how to relax your pelvic floor muscles. We also do visceral techniques, which means they're more like organ-specific techniques, which I'll talk a little bit about. A lot of stretching and mobility exercises if you need them. And then sometimes we also recommend some of those pelvic therapy tools to use at home, like I was talking about in the beginning. And you can see some of these at the bottom here. So these are recommended for different reasons. The first one here is called a pelvic wand. And depending on what's going on, sometimes depending on if there's tension in one area of the pelvis, you would use these for different reasons. So this is the pelvic wand, and then these are called dilators. So sometimes there will be tension in certain muscles, and it's better to use one versus the other. So that's why we have two different things here.
Kristen, there's two questions that would be good to go over now.
Okay.
Someone asked, what does pelvic floor, like, what does it mean by pelvic floor tension? So what does that mean?
Okay.
And then how do you know if you have pelvic tension?
These are great questions. So by pelvic floor tension, I just mean like tight muscles. So kind of like how you can get a knot in your back, like in your shoulder, you can also get the same thing in your pelvic floor. It just feels differently. So with constipation, the reason that that's important is because if you are constantly straining to go to the bathroom, or if you haven't emptied your bowels in like, say, 5 days, over time, doing that over and over again to your body, I'm going to go over this in a couple minutes, but when you're bearing down, if you're constantly straining and bearing down, all of that pressure that you're putting into your abdomen is basically your body has like a reflex response when you do that, and basically will tighten up your pelvic floor muscles. So if you're doing that over and over again, every time you go to the bathroom, it just kind of like compounds on itself and can lead to more tightness in the pelvic floor. And if you look at this picture, this is kind of a good picture for what we're talking about. If you look at this picture, can you see my mouse, Melissa?
Yes.
Okay. So this picture here, this is just like a sling of the pelvic floor muscles. It's just looking from the side. So you can see how it's attached to your tailbone here. And then attached to your pubic bone at the other end. So when you're straining constantly, and say you're straining and this muscle is getting tight and reacting to that straining pressure, it's basically like pulling your tailbone forward and creating even more tension. And then think about what you want to be doing when you're having a bowel movement. You want to be relaxing so that the hole can actually open and the stool can pass through. So that's what I'm talking about with the tension. So just like any other muscle in the body can get tight, so can the muscles in the pelvic floor. And then the other question was, how do you know if you have pelvic tension? So it can present in different ways. You might have pain. You might have pelvic pain, so pain with inserting anything vaginally. So that could be a tampon, that could be pain during a pelvic exam, pain during vaginal intercourse. That could be trouble emptying your bladder, trouble emptying your bowels. It could also be chronic constipation. Yeah. So in order to really know if you have pelvic floor tension, if you're experiencing some of these things and you're not sure, you should really just go and get evaluated by someone, because it's hard to know yourself if you're not having like clear-cut symptoms. Does that make sense?
Yes.
Okay, so let's talk about the breathing and the pelvic floor. So why that's important. So I have this nice picture here on the side. And we're actually going to practice this, but first I want to explain how this is related. So when we teach people how to relax their pelvic floor muscles, it all starts with breathing. The reason that's important is because your diaphragm is this, and shown in this picture, is right at the top, like underneath your rib cage here. So when you breathe in, what I like to tell my patients is when you breathe in, your diaphragm kind of gently comes down and makes room for your lungs to expand. So when your diaphragm comes down in this direction, it kind of creates some pressure in your abdomen and kind of forces your pelvic floor muscles to come down as well. So your diaphragm is lengthening, your pelvic floor muscles are lengthening on your inhale. So it's gently stretching your pelvic floor muscles when you breathe in. When you breathe out, everything kind of comes back up into that resting position. So if you've ever seen a baby, if you've ever watched a baby breathe, you would notice that their belly kind of like comes up and down gently if they're like laying on their back. And everybody is born knowing how to use their diaphragm to breathe. And then we grow up and we get stressed and we just breathe all up in our shoulders and our chest. So everyone gets really tight in their upper trap area in their shoulders because we're constantly hiking our shoulders up and breathing like that. So that can cause issues with being able to relax our pelvic floor. So we always come back to this breathing pattern. So you can test yourself right now if you're breathing using your diaphragm. So this is how you do it. So you can put one hand up on your chest, on top of your chest, and one hand on your lower abdomen. And then just take a nice deep breath and see which hand moves more. So when you breathe in, if you breathe in through your nose, you should feel more of the air going down into your lower hand in your lower abdomen. So if you take a breath in and you're feeling it more up in your chest, try and focus your breath so that you're breathing into that lower hand instead and keeping your upper hand more still. So as you breathe in, you want to focus the breath down into your pelvis and your lower abdomen. And as you breathe in, you want to feel like your pelvic floor, or feel like the area between your sit bones is kind of dropping down into your seat. And then as you breathe out, everything kind of just floats back up into the resting position. You don't have to like force anything. You don't have to like contract anything. It just kind of happens naturally. So that's how we start with teaching people how to relax their pelvic floor muscles. It's easier to do in certain positions. For example, if you have like your legs resting up onto like a chair or something like that, and you're laying on the floor, sometimes it's easier to feel like the widening between your sit bones because of the way the muscles are on stretch. So we always have people try different positions to see what works for them because everyone is different. So some tips to prevent constipation. We always ask on the first appointment if the person has a squatty potty or a stool at home. We always recommend using something to kind of elevate your feet so that your feet are nice and flat on the floor. If you can imagine being in like a bathroom stall looking at the person next to you and their toes are like, their feet are kind of like elevated and their toes are like pointed on the ground, that's like not a great posture for your pelvic floor, because if you're activating the muscles in your calves, it's going to activate the muscles all the way up the chain. And it's going to be harder for your pelvic floor muscles to relax. So we like to tell people to use like either a stool or yoga blocks, books, a rolled up towel, something like that, to get your body and your pelvis in a better position to relax. And this goes for both bowel movements and urination. So you should never be straining to start peeing or pooping. And then, like we just talked about before, using your breath to keep your muscles relaxed. So practicing that diaphragmatic breathing when you're going to the bathroom. So instead of like holding your breath and pushing as hard as you can try gently like blowing through your mouth like you're blowing out candles, to keep your muscles from tightening. Another analogy I like to use about when you're holding your breath and like pushing as hard as you can, think about what naturally happens when you sneeze. So your body knows what to do when you're sneezing, right? Most of the time you're not like peeing your pants hopefully you're not peeing your pants unless something is going on when you're sneezing. So when you sneeze, your body knows to contract those muscles and prevent anything from leaking out. The same thing happens because when you sneeze, you create all of that abdominal pressure and your body reacts and it closes all the holes. Same thing is going to be happening when you're straining and holding your breath when you go to the bathroom. And this is, again, bearing down is not good for your pelvic floor. Okay. So the next thing that I wanted to tell you about is when I mentioned that we also do some visceral techniques during our treatment. So that's more of the organ specific techniques. So if you look at this picture, it's basically showing a big circle around your large intestine. So this massage is basically like a large intestine massage. So it's moving stool. It's the last part of your digestive system. So it helps you move stool up and around your large intestine to empty down into your rectum. So if you're a person that has slower motility or dehydration, or like things aren't moving the way they should be, maybe you have scar tissue in your abdomen and things are getting stuck in one area, this is a great thing that's easy for you to do at home, and can make a really big difference in getting things moving. So I like to do just a big circle. Some people, if you've ever heard of the I love you massage, it's basically making an I, starting on the left side, you would make an I and kind of like massage your abdomen in like an I shape here. So starting from the rib cage and coming down towards the hip, and then coming up towards the other side of the rib cage and making an L, and then coming all the way at the other side of the hip and making a big U. So that's why it's called the I love you massage. But I think this is just as effective. So you can just do a big circle and just massage all the way around. You always want to massage in the clockwise direction because that's where your rectum empties into. If you were moving it the other way, it would kind of be counterintuitive to what you would want to happen. So this is the natural path of how the stool moves through your system. And then a little bit more about our sessions here. So at Wellist, we have all one-on-one 55-minute sessions. Our patients normally begin to see improvements. They notice within at least like 2 to 3 visits. And everyone always asks, how many sessions should I expect to come in for? A general recommendation is around 6 to 8 sessions, but that varies completely depending on the individual and what's going on in their case. So that's just a general rule of thumb, but it's very, very variable. And you can find us in Back Bay. We're located on 209 Columbus, right by the Orange Line. And we also offer virtual appointments as needed. And then this is our team. So Melissa's on here. She's the owner. She's also another physical therapist. There's me, another physical therapist. We have a really great team, including a nurse practitioner, Kathy, and an occupational therapist, Dina. So it's really great to have all of these different types of providers in our clinic because Kathy also has the ability to prescribe any compounding treatments if anyone needs something like that. And then Dina is also a yoga instructor, so it's great to have her for anyone who wants to return to any of that type of thing, postpartum or, so we all have our own specialties. And then this is a little view of our office, which I'm in. You can kind of see behind me right now. And I have my email on there. So I'd be happy to take any questions.
Thanks so much, Kristen. We do have a question in the chat, and then feel free, anyone else, if you have questions, throw them in the chat, or you can unmute and ask away. One question is more we love this question, for pregnancy and how you can prepare for labor, if there's any general recommendations.
So that's great. I love seeing patients who want to come in just to do birth prep because we need more of that rather than seeing them only afterwards in the postpartum phase. So for people who are feeling great during pregnancy and just really want to prepare for birth itself, we usually recommend coming in at least around 34 weeks to start the birth prep. And if you're having anything going on before then come in earlier. But the general recommendation is we see people in the 3rd trimester once a week, starting at 34 or 35 weeks. And we go over a lot of different like pain management techniques during labor, but also preparing for labor itself. So going over different positions that you can get into, doing a lot of perineal massage to prevent any vaginal tears. We do a lot of education about C-sections. We also do offer like partner training. So if you want to bring your partner with you, we can teach them a lot of the techniques that we do. We go over how to push, and that's another kind of similar thing as the constipation stuff. So keeping your pelvic floor muscles relaxed as you're giving birth instead of allowing them to tighten, because that is going to be very counterintuitive to what you want to happen when you're giving birth. And then, that's what we do for, and then of course, if you're having any discomfort or pain during pregnancy, we also work on a lot of that. So we do a lot of like pubic symphysis dysfunction. I'm blanking on other things that we treat during pregnancy.
Everything.
Yeah.
Everything. Okay. And then a question about examples of compounding. So that's like really highly specialized, and that's more offered to patients with significant pelvic pain. So that's anything from vaginal or rectal Valium, baclofen, things that would soften or relax the muscles, calm down the nerve irritation that would be causing or driving the pain. So we also do kind of like hormone therapy. So whether you're postpartum with low estrogen or you're getting into that pre-menopausal or menopausal, a lot of times that directly impacts the pelvic floor muscles. The low estrogen causes dryness, nerve irritation, pain, urinary issues, bowel issues. So sometimes just getting that extra estrogen or testosterone can be really helpful for that patient population, but that's very highly specialized. And Kathy does a very thorough evaluation to make sure that that's appropriate. And then, do you have to get a referral from your primary care?
No, absolutely not.
In Massachusetts, we're direct access. So you can come to us not having to go through your primary care, which is nice. The next question is, if chronic constipation could be a sign of pelvic floor tension, would a weak pelvic floor cause incontinence, while tension would cause chronic constipation? Can you not have both symptoms at the same time and both be related to pelvic floor issues?
This is a great question. And the answer, I think, is yes, you can have both. And a lot of times we see both at the same time. So when we see tightness and tension, usually that comes with weakness. And we usually treat the tension before strengthening to avoid creating more tension, if that makes sense. But yes, it's absolutely possible to have both weakness and tightness at the same time, causing different issues. And sometimes treating the tension will actually help with the incontinence, which is great.
We tend to overuse like our pelvic floor muscles that surround the rectum, and we underuse, for women specifically, the muscles around the urethra. So often we're overcompensating by like overly engaging those really back wall rectal muscles, and then the urethral muscles just kind of like don't do anything. And then it gets to a point where they become really weak and you can become incontinent, but also constipated. That's okay. And then my mom, women that are going through breast cancer treatment, how do we work with them? We love working with this population because a lot of times they have pelvic floor conditions, whether they've been through radiation or chemo, and they're taking any form of medications that would lower the estrogen. This directly impacts the pelvic floor muscles. So we see these people all the time. We also do a lot of work post-mastectomy and any sort of surgery for the breast cancer to reduce scar tissue, get the tissue to mobilize better, get more blood flow there. As Kristen said in the beginning, we're holistic providers, so we treat the whole body, and we really firmly believe that everything is connected. So if there's something going on up the chain, it's directly impacting the pelvic floor. There's research now that even clenching your jaw and having TMJ issues will cause, it is a form of like a pelvic floor dysfunction, because if you're clenching all day long, you're tensing your pelvic floor.
Yep.
Any other questions?
Those were good questions.
Yeah. So you have Kristen's email on here. We love answering questions via email. We also offer like complimentary phone consultations. So just reach out if you feel like this could be helpful for you, or you just have general questions about what you're going through. We love to help. Thanks everyone for coming.
Thank you.
Have a good night.